preservation these days is coming up in a big way, mainly because women are delaying having a pregnancy or getting married. So because of this, and also added to the fact that women in our country are having less number of eggs even in the late 20s and early 30s. The egg number is declining. 1 in 3 women who come to us with fertility problems have low egg numbers, but many women are not aware of it. So it is important to know that the egg numbers can start declining as soon as a woman hits 30. So if there is no plan to get pregnant or not get married, one option would be to do what is called egg freezing or egg. How we do this is we have to do the IVF process, giving hormone injections for about 7 or 8 days, and then we'll collect the eggs and then freeze them so that they can use it at a later date. This is called age-related fertility decline, and we do egg preservation. But apart from this, in the cancer setting, so when young men and women undergo cancer treatment, what happens is their ovaries and the testis gets knocked off with the treatment, which means post the treatment sometimes there are no eggs in the ovary, and similarly there is no sperm in the testis. So they find it difficult to conceive later on. So whenever any young man and women they need cancer treatment, it is important that we freeze their eggs and their sperm well before they undergo cancer treatment. So if we do this post the cancer treatment, when there are no eggs or sperm, then we'll be able to use the egg and the sperm we have preserved in the freezer so that they can have children of their own at a later date. So these days we are doing this in a big way, both for social reasons, as we call it, as if you want to delay your getting pregnant, we can freeze the eggs and freeze eggs for them. Second thing is for cancer treatment also we freeze egg and sperm. And the third thing what we are looking at also these days is even people who have rheumatic diseases or who have thalassemia. These are all some medical problems where they undergo bone marrow transplant, and that also can knock off the ovary, which means they won't be left with any eggs later on. So all these conditions these days we do egg freezing and also sperm freezing. So this is a very common thing these days.